Thank you for joining us for the 715 Health Check. My name is Phoebe James and I'm a Professional Development Officer with the Primary Health Network. Before we go any further, I would like to acknowledge the traditional custodians of the lands that we're all meeting on today. I come to you from beautiful Awabakal country and pay my respects to elders past, present and emerging. Just wanted to mention this session is being recorded. The recording and the PDF slides will become available on our PHN website in the Education Library in the next few days. We do have time for Q&A at the end of the session, so please feel free to put your questions in the question box and we'll hopefully get to all of them. There's also an evaluation that needs to be completed that will be automatically emailed to you at the end. If you could complete that, that'd be great. Today, presenting for us, we have our very own Christy Lee Priestley, who is the First Nations Health Access Manager with PHN, and Josh Fuller, who is a First Nations Health Community Engagement Officer. I will now hand over to Josh.
Thank you, Phoebe. Yama, everybody, and welcome. Like Phoebe said, my name is Josh Fuller. I'm the First Nations Community Engagement Officer for the Hunter New England Primary Health Network. Welcome. Tonight we're talking about a 715 health check and the information regarding that and how it all works. This is the QR code for a quick survey. If you just have time to go ahead and scan that, I'll give you a couple of seconds to do a quick survey for us if you get a chance, and people listening in from the recording as well. Just while we're talking about that, so just a bit about me. I'm a proud Wiradjuri Tabaga man from WA, New South Wales. I've been with the PHN for about 3 years now. I work across all our regions, across the Hunter New England, Central Coast and Mid Coast areas. My background is community health, so I've worked in and amongst community for around 20 years across all different sectors of mental health, out-of-home care, every sector except for aged care is the only one I haven't worked in. I'd like to acknowledge the traditional custodians on the lands on which we are today. I'm coming from you from the Awabakal lands, beautiful Awabakal people and lands. I'd like to pay our respects to the continuous culture and contribution that make up the life of this vast region that we live in. During the presentation, I will refer to Aboriginal and Torres Strait Islander people as First Nations people. Through the content today, we will be going through the acknowledgement, which we just done, learning outcomes, what is a 715 health check, who is eligible for this health check, what is the purpose, and who can perform the health check. Connecting with your client, components of a 715 health check, nurse follow-ups, and allied health follow-ups. By the end of this education session, participants will understand the components of an effective health check for First Nations people, identify strategies to improve health checks in their own services, improve awareness of the importance of screening, early intervention, and preventative healthcare tools, increase awareness of cultural diversity when performing a 715 health check, and follow-up services. What is a 715 health check? So a 715 health check is an annual health check for First Nations people, where they can get a free health care check once a year, as well as a free follow-up care if needed. The aim of the healthcare check is to help ensure that First Nations people receive primary health care matched to their needs by encouraging early detection, diagnosis and intervention for common and treatable conditions that cause morbidities and early mortalities. So this is a big thing that the PHN are pushing at the moment. We're running a campaign on the 715 health check. It's important to let your First Nations clients know these annual checks are very important, even if they are fit and healthy, that they need to, you know, make sure that they're getting their annual healthcare check. So even if they're fit and healthy, we want a baseline to go from. So when everything's going right, that's when we want to know what that looks like, and then we go from there. Health checks allow access for health professionals in general practice and community services to provide comprehensive health checks for First Nations people, and can identify follow-up monitoring and or treatment services required to improve their health and physical, psychological and social functions. A 715 health check can identify uses across a lifespan. Identify issues across a lifespan, create better outcomes, preventative measures, identify and manage chronic disease, and early intervention. It's the Closing the Gap initiative. It's a big part of the Closing the Gap initiative. So the quicker we identify, you know, any chronic diseases or any issues, we can get on them early. I'm just going to play a quick video here, and hopefully the sound works. I can't remember. I think we go. Phoebe, I might need your help.
That's all right, Josh. Just hit the play button and let's see if it works by itself.
Yep. Does the sound working?
No, that's okay.
No. It's in the little drop-down box, wasn't it?
Yeah, so in the sharing box.
Sharing box, where are we?
You'll see a big play button.
Sharing, there we go.
And under that, you'll have the screen box.
Show screen. Yep, there we go.
There you go. Thanks, guys. Yep.
So
And now,
yeah,
Josh, sorry,
yep.
Josh, you just need to go back to your drop-down screen and make sure your presentation's up because I can't see it at the moment.
Can't see the preso. So I'll go sharing.
Yep,
Drop down
the drop-down.
screen.
Yep.
Yep.
Perfect.
Got it.
Got it. Thank you.
Thank you. So yeah, eligibility. So if the client or the parent or caregiver identifies them as a First Nations person and they're registered with Medicare, they are eligible. 715 healthcare checks are available for the following age groups. So children age 0 to 14, adults age 15 to 54, older people age 55 and over. First Nations people of all ages can get an annual 715 health check. They are free at any Aboriginal medical service and bulk billing clinics. They do not need to be diagnosed with any chronic health condition. This health check is an annual service. The minimum time allowed between services is 9 months. The purpose of a 715 health check. The 715 health check is part of the Closing the Gap on Indigenous health initiatives to provide supports for First Nations people to better manage chronic disease. Support is initially ongoing and engagement, comprehensive primary healthcare in a culturally safe way. We want to provide evidence-based health information, risk check and other services for primary and secondary disease prevention. Identify health needs, including client health goals and priorities. Support participation in popular health programs, e.g. immunisation, cancer screening, chronic disease management and other primary services, as in dentist, oral services as well. Who can perform the health checks? So to provide a 715, you must be an eligible practitioner working in a general practice. You must also personally attend the client. You can't be a specialist or a consultant physician. When you provide the items, you must do all the following. You must take a client history, do an examination and investigate as required, keep a health check record, recommend appropriate interventions, overall assessment of the client, recommending appropriate follow-up care, advice and information to the client. I think that's a big one. Make sure you're providing good advice and information to the client, because a lot of mob don't know what services are out there or what's available to them. Provide the client or their carer with a copy of the assessment and the follow-up plan. Make sure that they have that piece of paper or an email or something to go with them so they know what the next step is. I see it all the time and used to work with clients in community all the time, was they get all this paperwork or they go to a doctor's and they leave with nothing, and they're just like, oh, I can't remember what they said. Unless you're making that connection with the patient, with the client that you're working with, a lot of the time, if you're not making that connection, they don't remember what you're saying, because a lot of the time it's clinical and you need to explain things properly and make sure that they have a plan to follow up on. Okay, I need to go to this person next. I need to go and do this next. I need to go and do that. Nurses can collect information, including gathering of client information for you and taking the recorded and routine measurements. So practice nurses and health checks. So nurses can collect information, including gathering of client information for you and taking and recording the routine measurement. Providing your client with information about recommended interventions at your direction. These activities must be performed in accordance with accepted medical practice and under your medical practitioner supervision. All other components of the healthcare check must include your personal attendance. If a practice nurse, Aboriginal health worker or practitioner is being used to assist in a health check, for example, collect information and provide information to the client, you must be satisfied that they're suitably qualified and have necessary skills and expertise and training. Connecting with your client. This is a big one for me. This is one of my areas that I shine. I love communicating with people. I can talk mouthful of marbles underwater and love to talk with people and connect. I think this is a big one, especially with mob. Just connecting with somebody when they're coming in to see the doctor is a big thing, and it helps them retain information a lot better. The relationship with you and your client is very important when connecting with your client. Offer quick informal yarn at the beginning of appointment. Don't go straight into the clinical aspect. We know it's a lot of time to sit down and have a yarn, but a lot of time it puts people at ease if you have time to sit there and have a yarn, talk about how their day is, who they are, where they're from, if they're new clients and stuff like that. You're just going to explain what the healthcare check is. So, you know, to keep you well and keep you out of hospital, we want to catch problems early. We want that baseline to work from. We want to keep you fit and healthy and at your best. And we need to know what that looks like, and we need to work on a plan to keep it that way. And it's okay if they don't want to answer anything today. There's no pressure. Like a lot of time it takes you know 2 or 3 visits for somebody to warm up to somebody and just to get to know you a little bit better and have a yarn, because there is trust issues with mob around organisations, with doctors, with people of authority, and sometimes you know building them relationship is key to finding out what's best for the client and what's best for their health. And you know, any question's a good question. Ask anything. You know, that medical jargon's really hard to understand for a lot of people because of how clinical it is and how big and wide and vast the healthcare system is. It's very scary for people trying to navigate that. How long would a check go for? I don't know. I don't know the answer to that question. Only you and the client will. And you know, make sure you're asking the right questions. You know, what will you be asking? Are you going to be asking, you know, how's the family? How's Bub? How's this and that? Just build that rapport to get to know somebody before you jump into, you know, straight into the hard stuff. The components of the health check. The health check supports a review of the client's health and well-being, including their physical, psychological, and social well-being. It also assesses what preventative healthcare, education, and other assistance should be offered to the client to improve their health and well-being. It complements existing services already undertaken by a range of healthcare providers. A good health check is useful to the client, making sure that it's useful. It identifies needs, including client health goals and priorities, supports a client to take charge of their health and well-being, provide a framework for primary and secondary disease prevention through healthcare advice, risk, and other measures. It provides a regular health check. Sorry, I just lost my screen there for a second. I'm just going to come back to that. There we go. Provide a framework for primary and secondary disease prevention through health care advice, risk check, and other measures. It provides the regular health care provider, includes a plan for follow-up of identified health needs, priorities, and goals. Healthcare check must include taking a client's history and undertaking examination and investigations as required. Making an overall check of the client, recommended appropriate interventions, providing advice and information to the client, keeping a record of the health check and offering the client a written report about the health check with recommendations about matters covered by the health check, offering the client's carer, if any, and if the medical practitioner considers it appropriate and the client's agreed, a copy of the report or extracts of the report relevant to the carer. The RACGP and NACHO 715 healthcare check templates. I'm about to pass this over to Christy Lepresi, who is the First Nations Health Access Manager, team manager, and she's going to run through the templates with everybody tonight.
Thanks, Josh. So here are the 5 new templates that have been updated to better reflect the age-appropriate health needs that span the life course. So I understand that not all practices use these particular templates, but this is just an example of one of them. And they fall into 5 different categories. So there's infants and primary school, preschool, primary school age, adolescents and young people, adults 25 to 49, and then older people from 50 plus. And these templates are not intended to promote a tick box approach to healthcare, but rather to promote clinicians to consider client priorities, opportunities for preventive healthcare and common health needs. So components of a 715 health check on these templates. You just have to keep clicking, Josh. Yep. So current health and client priorities, medical history and current problems, regular medications, allergies and adverse reactions, relevant family history, learning and work development, healthy eating, physical activity, exercise and screen time, social and emotional well-being and social history, cognitive memory, thinking and age appropriate, eye health, ear health and hearing, oral and dental health, skin checks, immunizations, substance use, including tobacco, gambling, sexual health, home and family, mood, examinations, cancer screening programs, cardiovascular calculation, and investigations into full blood count, looking at lipids, kidney function, and other tests as well. So this is just an example of the adults template for 25 to 49-year-olds that could be used in a consultation. And we're just going to flick through and just have a look at the template. So these are some example questions from this particular template. So when looking at medications, you could ask the question, are there any other medications that you're currently taking each day? Do you take any vitamins? For allergies, like asking them, are they allergic to anything? Do they have any trouble breathing around certain plants, animals? Do they get asthma? And just trying to ask these questions in a culturally safe way to get the best out of your client and the answers that you're looking for. And so, for example, gambling. Do you ever play the pokies, or have you bet on horses? And just trying to gauge if anyone in the household, is gambling, or if there's any concerns around gambling. Also with alcohol, do you drink any alcohol or use any other substance to give you energy or to relax? And there's ones for smoking and social emotional well-being, and just another way to ask questions to get the best answer out of your client. And we just got some more on sexual health as well, and eating, and asking them, how many meals do they eat per day? Are they eating fruit? Are they eating vegetables? Are they eating takeaway often during the week? Asking questions about their learning and their work, asking them how school is, if they're children, and asking them if they like school or how's work, around home and family. Do they get to see their family often? Like what their home environment is like? Do they have any issues where they're living at the moment? Around ear health and hearing. Do other people say that you have the TV turned up loud? Has there been any concerns around them being able to hear at school? Around their mood? Asking about their appetite. Do they feel tired? Are they angry, or are they grumpy? Is there anything making them feel angry or upset? And one's around oral and dental health. Just how are their teeth, and are they having regular checkups? Do they have any problems with their teeth? Immunizations, asking them if they've had the flu shot done regularly. Is their bub up to date with their immunizations? Their eye health, have they had their eye checks done recently? Is there any concerns around them being able to see? And then this is just the example of the assessment, where if there's any more investigations that need to be done, where you might look into doing like a full blood count or liver function tests. And then if any referral or follow-ups are needed, then this would be what gets filled in here as well. If there's GP follow-ups, or they might need to see a dietitian, a physiotherapist, or an exercise program, etc. Do you want me to pass it back to you, Josh?
I think that's it. Yeah, thank you, Christy.
Yeah, that's okay.
Yeah, so the follow-ups upon completion of a health check, if your client is assessed by you as needing a follow-up health services, you can refer the client for up to 5 allied health services per calendar year, plus 10 nurse follow-ups per visit per calendar year. Where you, the practice nurse or First Nations health practitioner, are at the same location, you aren't required to be present for the health check follow-ups. If it's up to you to decide whether, it's up to you to decide whether you need to see the client. So if you're all in the same place, it's up to you to decide if you need to see the client or not to the GP. Got a blank screen there. Oh, here we go. What was that? Nothing. The following provides some ideas of activities and discussions that might be carried out during a nurse follow-up consultation. These may be planned visits or when the clients are in a clinic for a GP appointment. So MBS item 10987 is a nurse follow-up appointment provided by a practice nurse for First Nations health or First Nations health practitioner. After a 715 health check has been completed, nurse follow-up visits are your opportunity to connect with your clients throughout the year between the 715 health checks. Actions should be related to issues identified in the original 715 and familiarise yourself with the client's health check before the follow-up appointments. This will assist in providing relevant and individualised care. First Nations people with a 715 healthcare check have 10 nurse follow-up visits annually. So these may be used to provide the following. So each follow-up appointment service may be used to provide the following: examinations, interventions and indicated by the health assessment, education regarding medications compliance and associated monitoring. So making sure they're taking their medications, making sure they're sticking to it, making sure they got a good plan. Sometimes they might need, the pharmacist to get a blister pack to make sure that they're taking them every day. Sometimes there might be too many pills there. You need to have them conversations with your clients, making sure, okay, your blood pressure's down, this and that. Well, make sure that the medication's happening, because a lot of time mobs sit there and they just agree and say yes, 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 yes. But then when they walk out, they're like, oh, I don't know. And then you're asking them. I used to do it with Nan all the time. I was like, Nan, what did he say? Oh, no, he said to take this pill, that pill, this pill. Have you been taking them? No, I forget all the time. Well, let's go down to the chemist and make sure that put in a blister pack so they're all, Monday you got to take these pills at lunchtime and dinner time and when you're ready, and making it simple for her, making sure she's taking her medication, making sure that when the nurse is catching up with them, to make sure that they're compliant with that, making sure they're looking after their health with their pills, checking on clinical progress and service access, and making sure that they're going to them appointments. So if you haven't gone and seen, just say you made a referral to the dietitian, well, let's go down. How come you didn't go and see the dietitian? What happened? Like, why have you not made that appointment? You've been too busy, follow-up questions around that. Education, monitoring and counselling activities and lifestyle advice. So just making sure, you're monitoring, is your mood down? What's going on? Do we need to, make an appointment with a counsellor? Do we need to, do you need to start looking at changing your lifestyle? Stop smoking cigarettes and sitting around drinking Coke. Do you need to start going for a walk every afternoon or start doing different things? And taking that medical history every time you've seen that patient or client when they come in, and prevention advice for chronic conditions and associated follow-ups. The chronic conditions are a big one, because you need to explain to your clients, this is a chronic disease, this is a chronic condition, so we need to look after it, and these are the tools that we're going to put in your toolbox for you to look after it. So we need to make sure in the nurse follow-ups that we're doing annually that they're using their tools in their toolbox and they're going to see the people that they need to see. Allied health follow-ups. So upon completion of a health check, if your client is assessed by you as needing follow-ups of allied health services, you can refer a client for up to 5 allied health services per calendar year by an eligible allied health professional. So if you're making them referrals with your clients, with them follow-ups, making sure that they're going to them or making sure they've accessed that service or what's happened with it, because a lot of time mob will go into places and they'll make an appointment and they don't like it, or they've heard, there's a lot of different reasons, but you need to make sure that communicating what's happened, how come this hasn't happened, how come that hasn't happened, and making sure we have information around that. MBS Allied Health Items 81300 and 8100 to 81360 are available to people of First Nations on referral from their GP follow-up and assessment. Components of follow-up items: a maximum of 5 allied health services are available per client each calendar year. This is an addition to allied health services available to eligible clients with chronic disease under MBS item 10950 to 10970. The 5 services can be provided by one eligible allied health professional. Example, 5 physiotherapy services or a combination of allied health professionals. Example, like 1 dietitian, 2 podiatry and 2 physiotherapy. Services must be at least 20-minute duration and must be provided individually to the client and in person by the eligible health professional. A written report must be provided to the referring GP after the first and last service, or more often if required. Referral arrangements. To access follow-up allied health services, clients must be referred by their GP to the relevant and eligible allied health professionals. Using a referral form for follow-up allied health services under Medicare for people of First Nations descent. The GP is responsible for identifying which allied health services are appropriate for the client. Eligible allied health professionals. There's a list there of allied health so physiotherapy, diabetes educator, podiatrist, audiologist, chiropractor, exercise physiologist, osteopath, dietitian, psychologist, mental health workers, speech pathology, occupational therapist, mental health nurses, and some social workers. So this is the Health Pathways site. Username on the right in the red. I don't know if can you see my mouse there, Christy?
Yep.
Yep. So yeah, if you need some more information, a lot of it's here on this Health Pathway site. Click on the left to Aboriginal and Torres Strait Islander Health, Aboriginal and Torres Strait Islander Health Assessment MBS item 715, and that will give you all the information needed. Please reach out to the Health Access team if any more is needed, and to the PHN, and we can come out and have a chat and look after you and see what's needed and go from there. Is there any questions, Phoebe?
Yes, we've had a few come through, which is very exciting. Thank you, everyone. We love questions. So have one from Serena. She asked, can an enrolled nurse working as a practice nurse fill in the 715?
Christy?
I'm not.
We're not sure.
Yeah.
Not sure. That's fine. Serena, what we'll do is we'll take that offline, find out the information, and send it through to you. Next question. If the patient doesn't have a chronic illness, can they still have the 10 follow-ups with the nurse?
Yes.
Yes. There you go. Are the allied health professionals mostly accepting the Medicare rebate? What is the rebate? Most likely, many allied health will charge an extra gap fee on top, and how is that being handled?
I'm not sure, Phoebe. I would have to look into that one as well.
That's all right. So Albert will get back to you as well. What I would do is, because there is a few, I'm happy to send this information out to everyone who's participated, along with the slides and the extra surveys that Chrissy and Josh has put at either end of this. So that's fine. Don't feel like you're going to miss out. And then we've got, how much of an Aboriginal and or Torres Strait background do you need to have to be eligible for the assessment? For an example, a patient's great grandmother has an Aboriginal background.
I'd like to ask the question back to the the person who asked it, does the person identify as Aboriginal? So whoever at the start we said who is eligible for it, anybody who identifies as First Nations, anybody who identifies as Aboriginal or Torres Strait Islander is eligible for a 715 health check.
Yep.
If their great grandmother is Aboriginal, then that makes them Aboriginal. But if they don't identify as Aboriginal, then
Yep.
they're not eligible for it. So it's up to the patient if they identify as Aboriginal. So, sorry, I'm going to talk a bit here about this. So, a lot of our mob don't know their history because of the stolen generation. A lot of our people were taken into homes and haven't found their families and were told not to identify as Aboriginal. It was a shameful thing. A lot of our families took different nationalities as their own because they didn't want to identify as Aboriginal or Torres Strait Islander because of the main factor. The reason was that you'd get your kids taken from you because they were Aboriginal. So a lot of our mob took different identities and they took different nationalities. So you could be any nationality you wanted, but if you were Aboriginal or Torres Strait Islander, government policy at the time stated that your kids were to be removed and put into care. So that has put a big strain in a lot of people's identity. A lot of our families don't know who they are or where they're from, or they're just going on that journey now and they're finding out that, you know, their grandmother was Aboriginal, but she never told them, they never grew up that way, but she actually is, and we now identify. So there's a big, that's a big question, but by the guidelines of the 715 health check, if the patient or client identifies as Aboriginal, then they are eligible for a 715 health check and they identify as First Nations.
Yep.
Perfect. Thank you so much, Josh. That was a really great answer. We've had Bridget come and save the day for our first question, guys. Yes, and Ian working as a practice nurse can do a 715.
Thank you.
We are still happy to confirm and get that information, but thank you for sending that in, Bridget. And Bridget would also like for someone to come to her practice and have a chat. I will hand that information over to you guys separately, but
Thank you.
Thank you, Bridget, for your interest. This is what we're here for. So they're the only questions that have come through. Thank you to everyone. I still do think we've got a little bit of time, so if you wanted to cram some questions in, do so.
Yeah, definitely. We also have the Health Access team, the First Nations Health Access team. That says Aboriginal Health Access team, but we're now under the First Nations Health Access team. We can support your practice with the following. So asking the question, asking people to identify. I just spoke a bit about that, what identity means and how a lot of our families are identifying late in life, and there's different reasons why, no fault of their own. The PIP, the IHI, the Practice Incentive Payments, Indigenous Health Incentives, the CTG PBS co-payment, the ITC, so Integrated Team Cares, we explain that and what that is around chronic disease, where it is in your area, and who to send referrals to. The 715 health checks, so having a yarn a bit more in depth about this, and also cultural safety, making sure your practice is culturally safe for mob to access, and making sure, you know, they're getting looked after and you're getting more of First Nations people through the doors. This is a national guideline to preventative health checks for First Nations people. So this is the 3rd edition. This is from the RACGP. If you would like a paper copy of the National Guide, you just email racgp@ragcp.org.au or give them a call on 1-800-4-RACGP. So this is the National Guidelines to Preventative Health Assessments for Aboriginal and Torres Strait Islander people. So these are some of the resources as well that we can provide your practices. The telehealth guide, strong mob, staying deadly and living longer. The RACGP, preventative health assessment. And also down the bottom here is a pamphlet about the health and wellness check. So there has been a push just from our PHN and the First Nations team to change the name of the 715 health check to a health and wellness check because of a lot of trauma attached to numbers that people were given. So 715, so I just spoke about people's identity, and a lot of the elders and stuff that did grow up in them homes were numbered, and that association with being numbered brings back a lot of trauma. And when talking to clinical people or people of authority, having a 715 healthcare check, if you don't say healthcare check, they wouldn't know what that meant, and that could bring back trauma and things like that. But at this stage, it's still at a 715 health check, and yeah. We also have a 715 health and wellness campaign. So I'm just going to play this video of myself and Robbie Watson. So Robbie is a First Nations Health Access Officer. Yep, and he comes out and if you're in the Hunter region, he'll come out and have your ideas about what a 715 health check is and what I just spoke about earlier, the list of different things that the First Nations Health Access team can help with. So I'll just go back to this again, and I'll go to click it. See, here we go. So yeah, so the current 715 Health and Wellness Check campaign is being rolled out in how many practices, Christy?
All the practices, although we're using Tonic TV in
20,
33 practices.
Yep.
And we understand not every practice has Tonic TV, but we have sent an email out, and we can resend that out with a link from Vimeo for you guys to be able to download the video if you would like to play that in the practice as well. So we're halfway into our campaign, and we have people from our team and another team in the PHN currently delivering the 715 health and wellness brochures, as well as some posters to put up in all the practices.
Just on that, the Coffee on Country podcast that me and Robbie talk about too. So we have, obviously we have the podcast Coffee on Country, but we have the last episode, Tremaine Renkmore, who's a Aboriginal health practitioner. He talks about his experience working in mainstream practice, and what he does in community and how he goes about his day-to-day and how he sees value in what he does every day. He talks about, different aspects of explaining to mob how important their health is and how important that is to take control. Like I said before, when I used to talk to Nan all the time, and when I talk to clients, when we go to doctors and things like that, making sure that they understand their health, making sure they have things to follow up on, making sure we're communicating that with them. Aboriginal health workers and practitioners are, worth their weight in gold in being able to talk to mob and bridging that gap of communication between the clinical side of things and the practical side when they go out of the office, when they leave their appointment. Just having them by their side, getting that information out of them and helping them on their their wellness journey is a big thing. Please give us a listen and have a listen to Tremaine's episode and how he talks about what he does and how he does it. So the idea of the podcast is to let mob know who we are at the PHN. A lot of people know who the PHN are, but they don't know what we do. So we thought a podcast would be a good way to talk to mob out in community because we have such a big region, and to let them know who's who and where to get help, because not a lot of people know, how to access different services, and also to shine a light on people who are in the community and what they do in community, because it's about them. It's about making sure people know who they are and where they can get some help, or just communicating that to them.
So Josh, I have had a few more questions come through. Just mindful of the time, and we are cutting into people's evenings. So can you co-bill the 10987 nurse item with a regular consult item 23?
Can you co-bill it, did you say?
Yes.
Can you co-bill it, Christy?
I'm not sure, Phoebe, sorry.
No, me either.
Yeah.
What I'll do with these questions is I might get good answers to them all and send them out to everyone.
Yes.
But let's keep going because it's a good exercise. Can we get someone out to help train nurses to do the check? Is that a thing that we're looking at?
715 healthcare check?
Correct.
Yeah. Yeah, so that, yeah.
Perfect. How do you approach regarding family history, as most kids are in foster care? So from you know what I mean?
Yeah. So here we go. My background was at a home care caseworker for about 7 years, but the family history should come from wherever the kids are come from, whoever the NGO is, or if it is from facts. So, DCJ now, Department of Community Justice. If it does come from them, if they're in care, if the kid's in care, they should have a full medical and family history, and
Okay,
that's where it needs to be followed up through the carer or the caseworker who brings them to the appointment.
Sure.
They need to provide that information.
Bridget has come through and saved the day again and answered our question. Yes, you can co-bill, Brianna. So there you go.
Thanks, Bridget.
Sorry.
Thanks,
Yeah.
Bridget.
Bridget for the win.
Yes.
Does the 715 replace a GP management plan?
Same, but different.
I don't think
Yeah. No. So a GP management plan would be a GP management plan, and 715 would be a 715.
Yeah, I would say that.
Same, but
very
different,
different.
but they might intertwine. Yeah.
Yeah.
To access the 5 visits for chronic disease, does the practice need to complete a care plan 721 and 723, or does it come from the 715?
I'm not sure on that one either, Phoebe. Sorry.
No. I've not had to do, like, I don't come from a practice background at all, so all of this is like another language to me. But I'm glad that it makes sense to some people. So Bridget, a GPMP, so that's the GP management plan, apologies, is for chronic disease management 721 and 723. And it comes from the 715, Chloe has let us know. I'm going to just amalgamate all of these questions and answers, guys, and send them out to you. But thank you so much for participating. Almet has let us know that it could come from both if the patient has a chronic disease. But that is all of the questions that have come through. So I'll wrap it up. I wanted to thank Josh and Christy for presenting tonight. These guys have done a mammoth effort. They have their own 9-to-5 jobs that they have to do, and putting together this presentation and presenting tonight is on top of that. So we really do appreciate it. Thank you to everyone for coming and taking time out of your downtime, family time, dinner time, or if it's a bad day, work time. But we really appreciate you guys being here and spending the evening with us. As I said, I will send out all of the slides to you, and I'll research all these questions. Great questions, guys, real impressive. Research all these questions and get them out to you as well. So thank you once again. Look after yourselves and look after each other.
Thanks, Phoebe.
Thanks, Phoebe.
Yellow, everyone.
Thank you.
Stay deadly. Stay deadly.